Welcome to another installment of ECSD Talk, hosted by me, Alan Buckler, station manager for the Ellenville Central School District's very own radio station, 107.9 WELV. We are recording this episode in February of 2021, and I'm delighted to be joined today by Steve Kelley, President and CEO of the Ellenville Regional Hospital. Hi, Steve.
Hi, Alan. Good to see you.
Good to see you, too. What are we going to talk about today?
We're going to talk about the renovations that we're doing to our emergency department.
Okay, yeah, I hear it's going to be a pretty major undertaking, so let's get into it. So tell me a little bit about the current ER department and what's the future plans for it.
Okay, so our ER was constructed, had a major renovation and a small addition in 2006. And so we improved the number of treatment bays from 4, which were curtain compartments, to 7. So it included a trauma room, an isolation room, 4 bayed curtains, with curtained bays, I should say, and another treatment room, and a triage room. Mm-hmm. And we are going to, what we have found through COVID is that we need to have additional isolation rooms because we need to be able to treat people who have infectious diseases like COVID, and we need to be able to have them be in a safe environment that's safe for them, and it's also safe for our staff and for everyone else who might be in the ER. Yeah,
so I guess this is an example of COVID-19 impacting the hospital, right?
It's a major impact. We have to really rethink how we deliver emergency services because that is a real concern. It's not as much of a concern as this wave is passing. We're not seeing anywhere near as many cases, but we did see quite a few cases in December and January, and it's been petering out. Certainly the ER, it's petered out mostly by now. We're not getting a lot of positive cases anymore. It's an interesting year. We didn't actually have any flu this year. This normal seasonal flu that we get every year was a Zippo this year. It was really a safe year.
It's interesting you bring up the high numbers in December and January, because you're right. Normally when I interview you, we talk about these high numbers in December, January, February, but it's regarding flu.
Right.
Obviously, that's interesting that there hasn't been much flu because of COVID. I did read somewhere months ago, I think probably 6 months ago, soon after the COVID pandemic had hit, I saw some predictions where people said because so many people are now concerned about hand washing, face masks, all those things, they kind of predicted there might not be as much of a flu impact because people have now being so careful and cautious, which normally we're not. So it's interesting that at least for Ellenville Regional Hospital, that appears to have been the case, right? Your flu numbers were way down.
Way down, and I think they were across New York.
Yeah,
my colleagues did not see much flu anywhere in the Hudson Valley. So
yeah, well, so a side question: Did the Department of Health declare a flu season?
I don't know if they did or not. Usually it's a big deal and we have to hear all about it. We didn't hear anything about it.
Because I know normally I
haven't heard much about anything.
Yeah, I know. I asked some of your staff when I used to interview them, and they would say it was declared on a certain date, and after the date they declare it, you either have to have had the flu vaccine or you have to wear PPE. Again, right. This is all pre-COVID. So yeah, I'd be curious to find out if the DOH declared a flu season or not, because maybe the numbers were so low, but who knows?
Well, we have really not seen any flu to speak of.
Yeah.
And COVID is definitely on the wane now. We're not seeing it very much.
That's good to hear. Good to hear.
So that is very good. And but what we discovered is that our single isolation room does not meet the current updated standards that now you have to have a full bathroom and a shower. It's like people could move in. It's practically like a hotel room. And these are going to be really nice rooms. And we're adding 3 new ones. So we'll have 4, including a bariatric one, which will help with some of our larger patients.
So has construction begun yet or not quite?
What's that?
Has construction begun on the new ER department?
Yes, we have the deconstruction. So we're doing it in phases because you have to imagine it's sort of like flying an airplane and deciding that you want to replace the wing.
Yeah, you can't just
wing is longer.
Right.
So we are doing it in a couple of phases. And in the first phase, we are taking the area that is kind of to the east or if you look at the hospital kind of to the right side of the ER and demolishing an area that's about 1.5 times the size of the ER. So that's an area that goes all the way up to our lobby. It includes the area of the waiting room for the current ER, the area where my office used to be, the area where the lab services were, and some other support space. And so it's a sizable area, and that is now under deconstruction, which is a nice way of saying demolition.
Right.
And so that's underway now, and that'll take a couple weeks, and then we'll start reconstruction. That'll take a couple months, and then we'll open that up, and that new space will house the laboratory again in new digs, which will be right adjacent to the main lobby. We'll have new registration relocated, so it'll be right by the main entrance, and there'll be a new waiting room for the ER with a new entrance, which will have an atrium entrance. In fact, I can show you what it might look like.
Oh, great.
Really nice rendering.
Visual aid.
You'll be able to capture that, but this is what it'll look from the outside. People will come in the same ER entrance for the ER. They'll walk through a high atrium, which will be lit at night with kind of red lights, so it'll have a glow. When people come on the campus, you'll be drawn right to the ER. And then you'll walk into the ER waiting room, which will be mostly a glass atrium. It'll be really dramatic and beautiful. So it'll really change the feeling of the emergency department. And I'm not sure that you'll be able to see this with the cameras that we have, but essentially this is the main existing entrance. You'll walk into the lobby. There'll be patient registration, the laboratory drawing station, and then the rest of this all the way down there is the ER, this whole space. So it's really big. It'll end up having the capacity for up to 9 treatment areas. 9 treatment areas plus triage, which could be 2 more treatment areas, so 11 treatment areas during surges, which is a big improvement. We won't have any curtained off areas. We will have areas that have walls, so there'll be a lot better privacy. They're larger, so they'll be more spacious, more private, and have all of the goodies that you need for supporting an emergency services.
Yeah, that's
and then you have the isolation rooms are kind of back here, and then so here's our existing trauma room, existing isolation room, plus the 3 new big ones. A new nursing station, which will be much larger. The one we have now is quite compact. Some would say that it's really tight. Compact sounds a little nicer, but this one will be really relaxed. Should be no stress there.
Yeah.
Well,
that looks pretty good. It's exciting developments. When did you guys at the hospital decide that this needed to be done? Like, what was the timeline?
We started in the middle of last year when, after the first wave came through, and it really showed us where our shortcomings were. Yeah. It showed us the things that we needed to do. This has changed everything. COVID has just changed the way we look at things. It's changed, it's like a paradigm shift. For years, we've been trying to have fewer beds in hospitals. We've been trying to kind of skinny down the healthcare services. And then we have a pandemic, and we just get wiped out with shutting down the country. Who would ever have imagined that it could be like this? Yeah,
that's crazy. Well, as you said, it changes everything. Case in point, what we're doing right now. I used to interview you once a month, once every couple of months in person, and now here we are doing it remotely because that's what we got to do. We got to adapt and keep moving forward and keep doing the best job we can. So that's exciting development. When do you anticipate the completion of the new department?
Our goal is to have it done by the end of June, in time for the summer surge.
Okay.
So it'll be about 2 months to complete the first phase, and then 2 months to complete the second phase, and that's the 4 months we have to get it done. So that's the plan.
And when you say summer surge, you're referring to the traditional increase in population we have in the summertime?
Yes.
Yeah.
I'm hoping that with the vaccines getting out, and people continuing to practice safety, washing your hands, covering your face, having social distancing, that we're going to be a lot healthier and people will be able to travel again. I think a lot of people have been coming to the Hudson Valley. Certainly our housing prices have gone up 20% or so as people from the metro area are buying up houses to live here because they can telecommute just like we are now.
Yeah.
So the need to live in the city isn't as strong as it was. And I think that people like the idea of breathing clean air. I mean, I certainly do. They like the country lifestyle, and they've learned that they could live that way. They don't have to be in the city. So I think that they will be coming out to vacation, looking for second homes, and at the very least, using our bed and breakfasts and camps and our recreational facilities and hotels. I think we're going to have a banner year for tourism this year. More so, I mean, everybody's pent up. Nobody went anywhere last year. We've been cooped up, can't go anywhere. We'll be vaccinated, so we'll be, no, I won't say quite immune, but at much lower risk to ourselves and others. And people are going to be traveling. And that means I think that a lot of people are still going to be a little loath to travel by air travel because you'll be in close areas and they recirculate the air, and that's one of the most dangerous things you can do still is fly. But if you're driving,
it'll be the resurgence of the automobile vacation, right?
That's right. Yeah, we should buy automobile stocks at least for a year or two. And
well, I certainly hope you're right, Steve. I mean, it's interesting you talk about that. I have a question, and I'm going to have you talk on the vaccine, not the science of it, but just about the importance of it. But before I ask you that, it's interesting you talk about the increase in population and people looking for second homes. I know someone who I knew someone who lived in New York City around 9/11, and right after that happened, there was an initial surge of people who were scared to live in the city, understandably, so they moved away. But that was obviously an isolated, somewhat terrorist incident as opposed to a global pandemic. So now you're seeing an even bigger shift, you're right, of people who want to, if they can, get out of the city because teleconferencing is certainly viable. And some people have a second home. Some people just say, I'm just going to relocate because I want to be able to go outside and not bump into somebody, which if you're in New York City, you can't do that, or any big city. You just can't do that easily. Whereas here in the Hudson Valley, there is plenty of space. So it's,
plenty of space.
It's still a challenge, but much more feasible challenge to just get in your car, walk on the sidewalk away from somebody else. But but you brought up vaccines. So I don't want to quiz you on the science of it. I know you're a CEO of the hospital, not a doctor or a nurse. But just talk to the importance of the vaccine and why is it important? Why people should get it, and what it will mean if people do get it.
So we don't have any natural immunity to this new virus. And so it isn't like it's been around forever. It's a new virus. And so we're completely susceptible to becoming ill. And I know a lot of people who have gotten it, and most of them survived. So, but even the ones who survived, a lot of them were really sick. I've had employees here who got sick. We've had a lot of family members of employees that work in other settings where there's close congregate space. I think you can imagine where I'm talking about around here, and a lot of the virus.
Mm.
Here we took great precautions. Our employees did not get sick, but they did get exposed, and they had to take time off. And some of them did get sick, but I don't think they got sick from here. We use really extreme precautions, and we can handle it. But what happens when you get vaccinated, then you become not quite immune. I don't think that they like us to use that, but if you're 95% protected, it means that you only have a 5% chance of getting it. And if you do get it, you get a much lesser case of it. So it's much less likely to make you sick for very long or even as sick. And since this is a very communicable, debilitating illness, if you do get it, you have about 5 or 6 days before you even know you have it, when you can go around and infect other people. And then even after you have recovered from it, you often are still contagious for a bit longer. And so it's really important to get vaccinated as soon as you can, if, supposing that you don't have any underlying issues that would prevent you, which is very few people, from what I could tell. So our goal is to get as many people vaccinated as possible. Most of the vaccinations are being done by the large physician groups and by Ulster County. We are doing really very little of it. We basically vaccinate our own staff and our, folks that are close to the hospital that volunteer here or some other reason that they're part of our organization.
Yeah.
And especially early on, front-facing staff members who were caring for COVID or possibly COVID-infected patients, which we treated everybody like that because we just didn't know, needed to be vaccinated. I was vaccinated. I was early vaccination in the first day that we did it here because I wanted to be able to reassure my staff who, not everybody was so wanted to be vaccinated. Nobody wants to be first on such things. Fortunately, I have not grown a third eye in the middle of my forehead or any other bad outcomes. I feel really good about being 95% less likely to catch a very, very debilitating illness. And I strongly encourage everyone to get vaccinated as soon as you fit the profile that the state approves. So especially people who are at any kind of risk, which tend to be seniors and people with jobs where they have a lot of public interaction. So school teachers like you, and people who work in stores, and police officers and first responders, rescue squad people are face to face with people up close and personal. So they need to be vaccinated. And then people who have conditions, cancer, respiratory problems, COPD, they really need to be vaccinated. And we're in the process of seeing a lot of people getting vaccinated. I'd say in the Hudson Valley, there is about 10 or 15% of the people have been vaccinated already, which I was looking at some statistics today that were very encouraging. And in the 11 or 9 county area that's serviced by the Westchester hub, they've been pretty effective at getting the vaccine out. And so the supply of the vaccine, which has been the limiting factor, not the number of people who want to be vaccinated, it's really been a problem of not having enough supply, and that's getting better. The supplies are being ramped up. There's other vaccines in the pipeline which will help, and so don't give up. If you haven't gotten vaccinated, there's still time. This wave is subsiding, so it's a good time to be vaccinated to avoid the next wave, which will probably hit in the fall. So if we can get enough people vaccinated, it'll really take the wind right out of the sails of the next wave, and it'll be a lot less. It'll be probably more like the first wave, which wasn't that bad. The second wave around here was bad. The first wave hit New York City and the metro area hard, but upstate not as much. But this time we had quite a few patients that were positive here in Ellenville.
Yeah. I totally agree with you on the vaccine. They do offer it here at the Ellenville Central School District to any staff member that wants it. So obviously I wanted it. I had my first one.
Good.
I agree with you. I concur. The more people who can get it, should get it, want to get it, do get it. I just fully encourage everyone who wants it should go for it, and everyone who can get it should get it. And
Yes.
Because there are some people who can't, perhaps for some reason, but most people probably can, in which case they should. Anything else you want to touch on today before I let you go, Steve?
No, I think that's really covers what's the things that we're working on, the highest priority. We are we're building an absolutely fantastic emergency services center here, emergency department. And we want people to know about that. It's going to change the workflows. We're already pretty quick. We're under 100 minutes door to door here, which is, there's not another emergency room on the face of the earth that's in the sentence with that kind of performance 13 years in a row.
That's a slightly comical question. Are you concerned that the deconstruction and reconstruction of a new area will impact those times?
I am concerned, yes. Do I think it's going to happen? Not that likely, because I'm concerned, and we will do whatever it takes to get people through quickly. People are used to being seen quickly here. They are used to getting their fast outcomes, results, and that's what we do. I'm very committed to that.
I know your love of that and love of metrics. I'm sure if like in a stat you see, obviously it will fluctuate. If it goes up by 1 minute, you're like, why did it go up by 1 minute? No, this is not right. This is not. Let's correct this.
That's what will happen.
Well, Steve, thank you so much for being with me today. And thanks for being my guest on the show, ECSD Talk. If people want to go to the website, I know it's a fairly new, about a year. It feels like a new website, but that's probably because I last spoke to someone a year ago and it was new then. So it's about over a year old now, I think. It's erhny.org or erhny.org. That's the new Ellenville Regional Hospital website. And that's where people can go to find out all kinds of stuff, phone numbers, websites, people who work there, departments, all that kind of stuff. So that's where people should go if they want more information about the hospital. And otherwise, that brings our show today to an end. So again, thank you, Steve Kelley, for being here. I've been your host, Alan Buckler. If you want to get in touch with me, then you can call me at the high school TV and radio studio at 647-0135 or email me at abuckler@ecs.k12.ny.us. So until next time, it's goodbye from me. And again, Steve, thank you so much for being here. Goodbye to you.
Thank you, Alan. Have a wonderful day.